Verbal communication means using spoken words to share information, ideas, or emotions. In health and social care, it's a vital skill that helps build relationships, deliver care effectively, and support emotional well-being. There are 9 verbal communication skills you need to be aware of. The first important skill is adapting your communication. This means adjusting how you communicate to meet the unique needs of each service user or situation. It's especially important when working with people who have dementia, learning disabilities, language barriers, or when you're in high-stress environments like emergency care. For example, you might use picture cards to communicate with a nonverbal adult with autism, speak slowly and clearly to someone with dementia, or use a translator to support someone who doesn't speak much English. It can also mean using simple words and a gentle tone when talking to children. By adapting your communication like this, you promote inclusion, reduce anxiety and misunderstandings, and provide person-centered care that helps people feel comfortable and truly understood. Another key skill is clarity. This means speaking in a clear, structured, and simple way, free from jargon. Jargon refers to specialist language used by professionals that others may not understand. Clarity is especially important when describing a service user's condition, giving instructions like how to take medication, or explaining treatment plans and appointment times. For example, instead of saying you're hypertensive, it's better to say your blood pressure is too high. And rather than saying take this medication BD, you'd say, take this medication twice a day. Clarity helps to prevent confusion, builds trust, and supports service users to follow instructions confidently and correctly. Next is empathy. Empathy involves recognizing and responding to the feelings of others with compassion and care. This skill is especially important when someone is upset, frightened, or in pain. For example, you might comfort someone who is upset after receiving a diagnosis or reassure a nervous patient before surgery by saying, "It's okay to feel nervous, I'm here to help." Listening carefully to someone expressing fear or pain and responding gently builds emotional trust, encourages cooperation, and makes service users feel respected and supported during difficult times. Patience is also key. It means giving people the time they need to express themselves without pressure or interruption. This skill is essential when working with elderly service users, those with speech difficulties, mental health issues, or memory loss. This skill is also useful in stressful or emotional situations. For example, you might wait while a stroke survivor tries to speak, repeat information calmly to someone with memory loss, or avoid rushing a child describing their symptoms. Being patient reduces stress, supports open communication, and prevents people from feeling ignored or frustrated. Choosing the right words or using appropriate vocabulary is just as important. Using appropriate vocabulary means choosing words that the person you're speaking to can understand. When talking to a child, use simple, age-appropriate language. When speaking to medical professionals, technical terms are often appropriate. But with service users, avoid jargon and use plain, everyday language. For example, you might describe an MRI as a big camera that takes pictures inside your body, say high blood pressure instead of hypertension, or say you'll feel sleepy instead of you'll be sedated. Using the right vocabulary ensures understanding, makes communication inclusive, builds confidence, and helps people make informed choices and give consent. How you say things also makes a big difference. Your tone of voice refers to the emotion or attitude in your voice, whether it's friendly, calming, firm, or respectful. For example, when delivering bad news, a calm and steady tone is best. When reassuring someone, a warm and comforting tone helps. A soothing tone can calm someone having a panic attack, while a firm but respectful tone is useful for setting boundaries. Greeting someone with a cheerful tone can brighten their day. The right tone creates a safe and supportive environment, prevents fear or anger, helps manage challenging behavior, and builds trust and rapport. Volume refers to how loudly or softly you speak. In quiet places like hospitals, speaking softly helps maintain a calm atmosphere. In noisier settings, like a busy care home, speaking louder ensures you are heard. For individuals with hearing difficulties, adjusting your volume slightly while staying respectful is important. Proper volume helps ensure clarity, avoids sounding aggressive, prevents embarrassment or distress, and supports sensitive and professional communication. The pace of your speech, how fast or slow you talk, also affects communication. Slowing down when explaining important information or during assessments helps people follow along and understand better. Pausing between steps when giving instructions allows time for processing. Speaking at an appropriate pace improves comprehension, reduces misunderstandings, and supports relaxed, effective conversations. Finally, being willing to contribute to teamwork means actively communicating and sharing information with colleagues to coordinate care. This is especially important during staff handovers, team meetings, and when reporting concerns or incidents. Effective teamwork promotes safety, improves efficiency, prevents errors, and ensures continuity of care. Continuity of care means receiving the same high-quality care over time, even if different staff members or locations are involved, because information is shared and the service user's needs are understood.